Tobacco control for me, it's more personal. Yeah, it's more personal, and even as we are going to share our experiences on what our organization is doing, I would want to usher that session.
Although they adulterated the law a bit, they placed there something that was not supposed to have been there, something to do with the smoking, the designated smoking areas. So that was in the year 2007 when we had the law under which we are operating. Now I'm insisting that all of us get a copy and we go through it. And we must always know that each one of us must help in the implementation of the same. We don't sit with what we have. As you have already heard, mostly in Kenya, we have the laws, but we don't even know them. We are not aware of these laws. You keep on crying that something is going wrong when you have the right even to take that person that is doing it to court. You can defend yourself using the law, and you are not aware. Sometimes people do wrong things, and then the innocent person is the one to suffer, and the guilty one is enjoying themselves. So let us know that the law is in place, it was enacted, and it is working. Meanwhile, the Kenya Tobacco Control Alliance was born in the same year that the FCTC was born, that's the year 2004, and then it was registered in 2006. So we have been in existence since the year 2006, and that's how we took part in the formulation of the Tobacco Control Act, and really tried to work on this. It was in fact Ketca that trained the first Tobacco Control Board. But we have been doing some work at the national and the county levels. We have got these two levels. So we work with the national government, we also work with the county government. When we talk about the national government here, we are talking about the mainstream government, we are talking also about the national institutions, like the Teacher Service Commission. We talk about the Institute of Curriculum Development and other institutions that we are working with, including the institutions of high learning, like the universities. We work with the NACADA, we have worked with the KRA, TSC, as I've said, the Institute of Curriculum Development. But the one that we work with mostly and every other time, including even in court, is the Ministry of Health. Then we have had a very major partner also nationally, and that is the media.
No single organization, no ministry in Kenya can do the activities of tobacco control alone without the support of where it operates. For example, if the Ministry of Health brings technical reports about the progress or about the health effect of tobacco use, then there is a required role to be played either by academicians, either by schools, universities, colleges, individuals, civil society organizations to push it or to communicate it, because the ministry itself pointing it out is not enough. I am happy that we have the people from the Kenya Institute of Curriculum Development. I had representation from the Teacher Service Commission. Yes, those are they are government institutions. They have a role to play. So we need to partner from whichever areas of our operations so that we can effect the issue of tobacco control. And this partnership, if well structured, is what we can call a coordination. We are coordinating the way we are implementing these policies, the way we are monitoring the industry, the way we are assessing, we are evaluating ourselves, but in a structured way. That is what coordination entails. These organizations require, they are doing a lot, but they require a structure that can coordinate their activities, so that we can know the much that we are doing and the much we have realized and the challenges we've gone through and the anticipated outcomes and even the challenges, so that we can counter them.
In the Tobacco Control Act 2007, there are some provisions that can only be implemented by the national government, like labeling of packets, and there are those that can only be implemented by county governments, like enforcement of public smoking, and all the others, sale of single sticks. It's the county government that has the mechanism to implement that. So we deliberately focused, and through the coordination of the players in this sector, through Ketca, we deliberately targeted county governments. So we were able to build capacity of county executive committee members in charge of health in 4 counties, that is Murang'a, Kiambu, Kirinyaga, Nyandarua, and it further extended to Nyeri, which was the 5th county. That had spillover effect to the chief officers, who are the executives, those who are delegated upon to execute. We built capacity of the county public health officers and their public health officers at the sub-county level, who are also used as prosecutors in cases. So having set the stage for proper implementation of the Act, we developed policy briefs extracting the provisions of the Act that needed enforcement, singling out the offense and the penalty. The offense and the penalty. Deeper reference could be made to the Act.
We've been able to do several things towards tobacco control. I'll briefly mention just some of the activities that we have done and finally say what we plan to do in the future. So when I was the chair, I organized from the year 2016 to 2017, we did a mental health talk. It was a 1-week event. Okay, not the talk was at the end, but we had a mental health week forum in our university organized by medical students and then in association with the umbrella body. Being a medical student, we understand what tobacco can do, but the sad thing, we are also the ones who are really involved in tobacco use. We have seen patients dying, we know the effects, but we're still involved. There were still even some of our teachers, especially our teachers, the doctors that we see that is soon going to be, they even know more, but they are also smoking. So it kind of tells you it's not just a matter of knowing what tobacco can do, there's something beyond that needs to be done. Yeah, just knowing is not enough, there's more. Probably if you catch these people early, they may stop because when sometimes they come to realize when it's too late. In 2018, this year in February, our association had small groups, focus group discussions, talking about what drugs are doing, especially for medical students. It has been an issue. In fact, our dean approached us, the association, we see what we can do among medical students. We got a report that most students who go to hospital, the history of drug abuse actually are medical students, which is a sad thing, and then together with other students. So now future plans, what you're planning to do, together with the umbrella organization, which is called Musake, we want to run an awareness campaign starting the month of May. We are going to use online platform because we realize most university students at least have an access maybe to Facebook, Twitter account, most of them, so we are able to reach such people. We are going to educate them on the effects of tobacco, both on the health and even what we've heard, it doesn't only touch on the health alone, it also goes beyond even economically we have seen. So we will do a 1 week to create awareness. Currently in the international body, we have come up with a manual that is being released.
I think Mercy has set the stage for me by talking about the students' experience in higher education. So I'm going to share about, from my side as a member of staff, and I will talk about what KU has done. Now for Kenyatta University, we have 2 departments. we have the Wellness Center that looks at the well-being of the students and their health. And then we also have the mentoring department. So these two really are critical in these matters to do with substance and drug abuse. The Wellness Center has counselors that students can go and consult. The mentoring department has been creating champions and peer mentors. So there is a lot of activity that has been going on, because you've heard what Marcia said about the university. A lot of, most of the things, the shisha, the tobacco, the alcohol, has infiltrated the universities a lot. Then we also have a policy on drugs and substance abuse. We celebrate the International Day on Anti-Drugs Abuse. Recently in March, we had the Anti-Alcohol and Drug Abuse Week, and NACADA and other stakeholders they participated in that week. So the champions, from the mentoring and the wellness center, the student champions were active throughout that week. There was a lot of posters, and you could see a lot of activity going on to create awareness on drugs and substance abuse. Now, what opportunities do I see as a faculty? I think our Vice Chair talked about the research, that indeed there's need for research. From our end, we need to check the effects and even the causes. How come our students, this young generation, is smoking everywhere and all the time? What has happened? So I think we need to do that research. We need to check on the effect of it also. Then on the teaching, I think we need to integrate the member from KICD, again I forget the name, talked about the curriculum reforms that are ongoing. So for us in higher education, also thinking now with the changes in the curriculum, how do we also start teaching? Like I am from the School of Education, and Kenyatta graduates over 6,000 teachers every year. So I'm asking myself, how will I be able to bring these discussions into my class? So I think that is an opportunity for me. Then on community outreach is how can we, even as a university, partner with other organizations, even be part of the alliance here. So it's, that's an opportunity for us. And also schools, we also partner with schools. We have a lot of contact with schools. How can we get into those schools and bring these discussions into the schools through our teachers? Advocacy, I think there's a gap in terms of creating the level of awareness. Like for me, it's the first time in this consultative forum, and listening to the chair talking about the background, that we were the first in Africa, that says something. And maybe you are hearing it for the first time. So imagine if the young people hear this, that there are these initiatives. So I think creation of awareness is important for us. So a lot of advocacy, I think, is needed from our end. Then I think I've talked about partnerships. How can we partner with organizations and the county government on this agenda? So those are opportunities for us. Then I was thinking about the challenges that I see. And one challenge as a teacher, I'm seeing a challenge with this generation. Some people will say it's the shisha generation. I don't know. The millennials, they are presenting some characteristics and some challenges. The generation that you can't easily talk to, they're not willing to listen to you. And when you say the girls are smoking the shisha in high numbers, you get worried. And when you talk to them, how many listen? It's a challenge. So I see that as a challenge. So I think also for research, we need to find a way of talking to this generation of young people. Then another challenge I see for us is how do we reach out to our students in the various modes? We have the regulars who come, we have those ones who are distance learners, we have those e-learners, So there are all these different modes. So how can we reach out to all those? So that's another challenge. And then, of course, the curriculum reforms. How do we integrate these issues as we are also preparing on how to teach our teachers? So that's going to be a challenge. And finally is enforcing the policy. Because someone has said that Kenya, we have the best policies. You know, there are blueprints from the national to the local, even to the schools. You go to a school, you come to our university, you find we have blueprint policies. But to what extent have they been implemented? I think that's the challenge. How can we ensure that, like for instance, even the staff, you know, we have those smoking zones, but imagine our staff. As a professor, why would I smoke in my office? You know, we need to reach out also to them, isn't it? So there is that other challenge. I think seeing that our members of staff are also driving this agenda, looking at what our students are doing in the hostels and out within the university, also that so that the policy is enforced. So those are the challenges that I see. Thank you.